I'd like to invite Dr. Monica Tincopa, who's an investigator in the NAFLD Research Center, who just joined our team this month. Monica.
Okay, thank you everyone. I'm very pleased to be able to join you today. So I'm tasked with a very brief overview of diet and exercise in fatty liver. So as you heard from our patient panel, reviewing dietary habits and exercise habits are very important for fatty liver, and we'll go over why that's the case. So here I think is a very powerful image that you may have or may not seen before. But the reason we talk about nutrition and physical activity in fatty liver is because it goes along very closely with what an individual's risk is of developing this condition. So here you can see across the globe, the percentage here reflects what percentage of people living there have fatty liver disease. And then along the bottom, you can see it's color-coded by the average caloric intake per day. And you can see the risk of having fatty liver disease increases as your overall total caloric intake per day increases as well. And so that's why when we take care of our patients with fatty liver disease, we really want to get a good sense of what is your overall dietary habits, and we'll get into exercise as well. That doesn't tell the whole story. There are other risk factors that also impact your risk of having fatty liver disease. So as you just heard, having diabetes also significantly increases your risk. There are genetic factors, so that's why we think race and ethnicity plays a role. What your sex is also plays a role, and then BMI, as you've already heard. Why do we talk about this? So there's been really good studies that have shown in individuals who have fatty liver disease and have had multiple liver biopsies, as they lose weight, we see specific different changes in their liver biopsies. So the numbers that we quote usually is as individuals lose about 3 to 5% of their body weight, the amount of fat in the liver will go down. As they lose 7% of their body weight, the amount of fat and inflammation will go down. And kind of the key number that we really try to emphasize is 10%. As individuals can get to 10% and keep that 10% off, fat, inflammation, and actually scarring can go away. So the great thing about fatty liver is if we catch it early enough, it's completely reversible. And so that's why we really emphasize this. As we're doing research to look for, medications that can treat and all these other studies, these are the things that we can do in the meantime that we know that can help individuals. Dr. Edgemeyer also talked about this. It's not just weight alone, which is why we like to not just focus on that number. We know about 25% to 20 to 25% of individuals won't have an elevated BMI, but they still have fatty liver. And as you heard, there's a number of different things that play a role. Some of it has to do with not just your total weight, but where you hang on to the weight. So individuals who hang on to fat within their organs have a much higher risk of having fatty liver disease than individuals who have it elsewhere, like just under the skin. In terms of what dietary patterns do we look for, so we know very clearly that individuals who have a very high percentage of carbohydrate intake have much higher rates of fatty liver disease, which is why we likely see much higher rates of fatty liver in individuals with type 2 diabetes. The specific thing that we've also seen too is there's a very high association with high fructose corn syrup and rates of fatty liver disease. So in clinic, we try to get a sense of, not only what are your total calories per day, but what are the types of things that you're eating. Individuals who have high rates of high fructose corn syrup have much higher rates of fatty liver disease, which we have seen in the study here. So they tracked overall carbohydrate intake and specifically high fructose corn syrup. And individuals who have high rates of high fructose corn syrup had much higher rates of fatty liver disease. The other things that we know is individuals who have high amounts of red and processed meat intake have higher rates of fatty liver disease, high amounts of dietary fat, but it's not just fat in general, but it's what type of fat. So saturated fatty acids have been very clearly shown to be increased association for fatty liver disease. And then, as I said, calories also are important, but it's not just your total calories, but it's really where you're getting your calories from. So again, in this study, just kind of tracked what's your calories from high fructose corn syrup and also from red and processed meats. And again, if you had higher rates of those things, higher risk of having fatty liver. And then this other graph on the bottom shows if you have a higher percentage of saturated fatty acids, that also increased your risk of fatty liver disease. So then the question is, what type of dietary pattern should I be following? There's tons of research on this. A lot of it is conflicting, but the take-home point is whether you follow a low carbohydrate versus low fat, there's benefits to both of them. There's a lot of evidence in support of something called a Mediterranean diet. So if you've come across that, this is a picture that kind of emphasizes what's in that diet. Has a very heavy emphasis on lean protein, so a lot of chicken and fish, a lot of green leafy vegetables. The important thing to know is you may come across literature that says that it's important to drink a glass of wine per day. So in the liver community, we specify that that's not part of the Mediterranean diet that we emphasize. But Mediterranean diet is a dietary pattern that's very different than what the kind of average American diet is. But we've shown that as patients follow this pattern of nutritional intake, they have benefits from a fatty liver standpoint. In terms of kind of take-homes again in the clinic, because it can be hard to get into all of this, it's hard to necessarily know where do you find high fructose corn syrup. So it's in regular sodas, sugar-sweetened beverages, a lot of prepackaged meals because they use it as a preservative, and they don't usually advertise that it's in there. So you really only know if you look at the food label. A lot of fast food items have that red and processed meat, so it can be tricky, but actually pork is considered red meat. So beef, pork, lamb, hot dogs, and then the processed meats are like bacon, cold cuts, sausages, things like that. Carbohydrates, it's not just carbohydrates in general. You can get into a lot of details about processed, refined, etc., but these are the broad categories. And then, as I said, serving size, portions, total calories also are important. And just a quick note on physical activity. I like to emphasize that exercise is not a primary way to lose weight. The reason I emphasize that is patients will start exercising a lot and they won't see that they lose weight, and some may gain weight. That's because muscle weighs more than fat. Even if you're not losing weight, the studies have shown very clearly individuals who are more physically active have less amounts of fat in the liver. So it's important, even if you're not seeing the number on the scale drop, this can still have significant benefits in terms of your liver. And we know that it helps with heart health. It has a positive impact on health-related quality of life. So exercise is very important and very, very beneficial. In terms of what type of exercise, that's the other question that people ask. Well, the guidelines for any adults in the U.S. is 150 minutes per week. Obviously, you have to evaluate where you're starting with, and that's the eventual goal. And there's a lot of different things depending on what you have in your medical history that may preclude certain types of physical activity. But usually, no matter what's going on, we can put a plan together that you can still get moving. So studies have shown that whether it's aerobic, which you typically think of more like running, jogging, things like that, versus resistance, which tends to be like light weights, these elastic bands, no matter whether you do the kind of more intense cardiac workout or the less intense in terms of less physically straining resistance workout, they're all beneficial. So even if you have limitations, you're like, oh, I can't run, I can't jog, I can't do certain things, there are ways that you can still move your body and get the benefit in terms of your liver health. In terms of intensity and frequency, again, people want specifics about what should I be doing. Some studies have shown if you break it up to 5 times a day as opposed to one longer session, that's helpful. And then individuals who get to that threshold of at least 250 minutes per week have been shown actually to have reductions in the amount of scarring. So it's not only just moving your body, but how often you do it and how much you do it is important. So to summarize, a healthy diet pattern and regular physical activity are the primary treatments that we have for fatty liver disease until we get to a point where we have specific medications to treat it. The benefits of healthy eating and exercise on liver health are seen even if you don't achieve weight loss. In terms of big take-homes, high fructose corn syrup, red and processed meats, high amounts of carbohydrates are all very strongly associated with fatty liver. So even if you can't make huge changes in your diet, trying to minimize these will also have a big impact. And in terms of physical activity, the eventual goal ideally would be reaching about 150 minutes per week of regular physical activity. Thanks very much.